Hey guys, and welcome back to the Dr. Marketing Tips Show. I'm Corey, and today's episode is going to sound a little different than what you're used to. So instead of the usual back and forth, we're featuring a special presentation that Jennifer gave recently at the MGMA Summit. And it's all about how medical practices can harness AI and automation to improve marketing, reduce some staff burden, and meet the rising patient expectations, all without breaking the bank. So I'm here to intro this episode for you, and then I'm going to turn it over to Jennifer to give her talk. And she covers a lot of ground in this one. So we talk about online scheduling, chatbots, workflows, review automation, all of this kind of stuff that we normally talk about on the show, but this one is very specific to the MGMA Summit and medical practice managers, as well as being very research-based, even more than the usual show is. So if you've been wondering how AI can fit into your current strategy and how to kind of prepare for the future, this episode is packed with practical ideas, some real results, and some things that you can be doing right now. So without further ado, let's get to it. Take it away, Jen.
So today we're going to talk about employing generative AI for automated content creation. We're going to talk about how you can create smart workflows to personalize patient communication. And we're going to talk to you about some reporting mechanisms really to track ROI through algorithms and analytics. And I think ultimately what we're going to tackle today is if you can remember way back when the iPhone came out or the iPad came out, and you weren't sure how this new technology was going to impact your life. But then, you fast forward, 20, 25 years at this point, and you think, wow, I use these devices every single day. And sometimes I don't even realize how much I'm using these devices, and they're now interwoven into my day-to-day. And I think that's what we have to think about when we're thinking about AI and algorithms and automation and things like that. It's not that AI and algorithms are going to just get rid of all jobs or add an additional layer to our day-to-day. In fact, what they're going to do is they're going to, one day, in the very not so distant future, they're going to be integrated into things that we're already doing. They're going to make our lives easier, kind of like the iPhone made your life a little bit easier. Smartphone technology really changed the way that we do things and the way that we see the world. And AI is potentially going to do the same thing, as well as automation and things of that nature. So let's not be afraid of the future, but let's embrace the now, knowing that wherever it takes us, much like the iPad or the iPhone, it's going to take us to a place, hopefully, that's going to make our lives a little bit easier. And so with these learning objectives in mind, let's go ahead and get started. So what we're going to talk about really is, let's just start with the challenge. How has AI and automation really kind of changed the way that we're thinking about things? Well, number one, marketing has evolved. Marketing doesn't just evolve year over year. Since the advent of ChatGPT and tools like that, marketing has changed by leaps and bounds, literally in the last couple of months or the last year, much more than it has in previous decades. On top of that, patient preferences have changed. And we haven't all kept out. Everybody is burnt out. I read an article just this morning in the New York Times that talks about AI and automation and how it really is giving us kind of this 24/7 view of productivity. And, we're always expected to do more with less. And, this becomes part of the challenge with AI and automation is how much more can we do? So the solution becomes, do we do more with less or do we just do more? So if we're looking at what those challenges are and we start looking at what that potential solution is, the solution really is to connect AI to our business outcomes. By 2027, more than half of providers are going to use AI automation to mitigate staff shortages. That's just because, AI can automate a lot of things. It can make our jobs easier per se. And, since we're continuing to see staff shortages, maybe AI can help us, and doctors are seeing that. And if you're not offering a digital first experience, patients are going to go elsewhere. That's where we have to start integrating AI and automation into everything we're doing from a patient experience, because it helps us take that digital first, that digital front door to that next level. And I'm going to talk about a lot of stats. I always do this when I'm doing my talks here with the MGMA, and I appreciate the MGMA always inviting me back. But some of the stats that I'm going to rely on in this presentation are some amazing stats that are being brought by Press Ganey and by Stat Healthcare. It's these surveys from some other amazing sources as well. And I'm going to call on thousands upon thousands of hours in the trenches working with medical practices just like yours. Not just my knowledge, but also the knowledge of my team back at Insight Marketing Group. So this is not just coming from me directly. It's coming from this amazing research, this data, and working in the trenches alongside of you. So let's get right to it. Let's talk about the evolution of marketing and how marketing has changed in many cases for the better. So let's start with the patient journey. Now, the patient journey back in the old way, that's the top here. Step one is that this isn't even the old way. This is the old way as of a couple years ago. But the patient would start with a search, orthopedic doctor near me, something to that effect. And they would go on Google and they would look at it. Then they would say, they would talk to a friend, maybe a physician, and say, my knee's really bothering me. I need to go see an orthopedic doctor. I looked up this Dr. Jones, and Dr. Jones seems like a decent guy. He's got good reviews. What do you guys think? And then friends and family or doctors would say, you know what, that makes sense. And then patient would go and visit their healthcare provider. They'd make that appointment and they'd go see the doctor. And that's how that they refer themselves to the doctor. But the new way is a little bit different. Patients are, sure, they're turning to search, but they're also turning to places like ChatGPT or Perplexity or whatever your flavor of the day in terms of AI is. That's where they're turning. They're actually starting to have conversations with these pieces of technology, and those technology is delivering snippets back to the patient to help make that suggestion. So they're starting with AI-driven tools. And then they're going to check the online reviews. They're not going to their physician anymore. They're going to their online reviews just to make sure that that doctor has good star ratings. It doesn't have to be a 5, but 4.5 to a 5, that'd be fine. And then they expect that they can go to the doctor's website and they can schedule an appointment. They can talk with the chatbot. They have a seamless experience. That's the new way of the patient journey. And so really now, and this is all the press data, this is some of that Press Ganey data I was just talking about. Now patients have the discovery process. They're relying on digital sources more than 3 times than provider referrals. They're not going to their primary care physician and asking for a referral. They're going to Google or they're going to ChatGPT. And then before they're making a decision, kind of when they're in the consideration stage of choosing a new doctor, patients are looking at 5 reviews and visiting 2 to 3 different websites before they're choosing their provider. And you can do this with a cup of coffee in your hand on that smartphone, and you can ping from website to website to website, review the doctor in maybe the course of less than a minute to make that decision. But they're looking at 5 different reviews. And then they're making sure that the quality and completeness of a provider's profile online is there. It's very important that there's a picture of the doctor, that it says if they accept their insurance, things of that nature. Then the patient goes on to schedule. That is more than 60% of consumers now prefer to book via a digital channel, whether it's online, in an app, or an email. They do not want to pick up the phone and call the office. Think about it. With your kids out there or your grandkids or your younger workers, they would rather text you than they would to call you. And it's the same for our patients. Quality of customer service is the top driver of loyalty and 5-star reviews, and we know this to be the case. And referral leakage is the availability of relevant and accurate information online. So how I said before that the completeness of a provider's profile online is the number one factor when it comes to booking. Referral leakage, you also have more leakage when you don't have those provider profiles updated. All of this matters because the patient journey has changed, and this is where AI is going to start to help us eventually. So something to take into consideration that this year's Press Ganey, this most recent Press Ganey Consumer Trend Survey really talks about, for the very first time since they've been doing this, that search, i.e. Google, Bing, whatever it is, has surpassed provider referrals for the very first time. And I'm saying this because, sure, AI isn't showing up on this, but in 2023, ChatGPT did not exist. So think about that. When this next survey comes out next year, how much will ChatGPT and Gemini and Perplexity and Claude and all, you name it, how much will it impact the way that people are searching for their providers? We've seen in just a handful of years that provider referrals have started to drop and search has replaced them. But what will be that next thing that's going to change the way that the patient kind of partakes in the journey of choosing new healthcare providers? Now, right now, Google's still number one platform in the consumer's online journey. You can see that up here at the top at almost 60% turning to the search engine first. But will that be forever? All other search engines and non-healthcare sites, the things like Yelp and Facebook and those have seen the greatest decline since this last survey came out. But you're seeing more and more that insurance websites, your review websites, things like that are making a real difference. And again, AI data wasn't even available at the time the survey was put together. So how do we build trust? Well, first we really have to focus on the quality of our reviews. We have to pay attention to the doctor's rating. It doesn't have to be perfect, but it needs to be good. We need to look at the most recent reviews, the total number of reviews. It's all about frequency and just making sure we have new reviews that are going out there on a regular basis. AI can help us with all of that, but that's how we build trust in this digital world. There's power in numbers. The more reviews you have, the more trustworthy the data becomes, builds consumer confidence from the get-go. This is all part of that new patient journey. And then think about it. AI has just kind of blown up this patient journey. Again, we don't have current data because ChatGPT and Claude and Perplexity and those tools were not even available at the time of the last Press Ganey consumer trend survey. But at the middle of all of this, the middle of the entire patient journey, is now AI being thrown into the mix. And this graphic was made using AI just to kind of show you we have all these ways that the patients are finding us and are paying attention to our practice and choosing their doctors. And AI has just blown everything up, or it's about to. So let's talk about the AI revolution. So let's say, why does AI have the potential to revolutionize healthcare marketing? Well, from a provider perspective, 60% of providers are going to use AI to automate staff shortages by 2027. I already talked about that. That's because providers are adopting AI to streamline their workflows and overcome these operational challenges like staff shortages. We see it all the time now. We talk about front desk staff or call centers using AI to help answer questions from patients, to do direct scheduling, things of that nature. That is going to get more effective over time as we become more adept at using AI and automation in our day-to-day. Kind of like when the cell phone came out. We weren't sure how it was going to change our world, but it did, whether you realize it or not. It's entrenched in everything we do now, is that little computer that we keep in our pocket. From a consumer perspective, over 60% of consumers prefer to book appointments via digital channels, kind of like your younger office staff. They don't want to pick up the phone. Our patients feel the same way. If I can book somebody to come fix my dishwasher at my house without having to talk to someone and have an appointment show up, I'm just used to being able to do that. And I expect the exact same thing from my healthcare provider. Patients increasingly demand, all of us demand, seamless digital-first experiences, especially for tasks like appointment scheduling. It's this perception that AI should make our jobs and our lives easier. And that's how it's going to revolutionize healthcare marketing. So let's look at ease of use. Digital convenience is expected. We just said that. Almost 61% of consumers prefer booking online. Well, the perception is that 52% of consumers say relevant online information impacts their decision. This is that Press Ganey data that literally says, that looks at consumers and says, how do I choose my healthcare provider? It's all about the information available online when I'm looking for my healthcare provider. And then patients also expect proactive, personalized reminders and updates. This kind of blows your mind when you think about interoperability. Your EHR, you are lucky if it's working the way it was sold to you to work, and that it's integrated and your entire team is using it effectively. And now I'm asking you to add in patient reminders and online scheduling. And I want chatbots, and I want everything else to work on my system to make it simple for me. But that's just the fact in the way that it is these days. Well, AI and automation, it's helping us to bridge the gap. So as it relates to ease of use, AI automates and optimizes those digital touch points for you. It can help us with scheduling and reviews and the online profiles. It can help us with personalized communication at scale using smart workflows. And it can help us increase efficiency, empower our staff to focus on the high value interactions, the one-to-one customer interactions. AI can kind of be running in the background so your staff can focus on those high value conversations. So let's talk about AI from a patient side. Again, patients prefer that digital first solutions like online scheduling. Well, AI-powered scheduling systems help reduce staff workload while offering patients 24/7 to booking and rescheduling. Transparency and trust. 52% of patients value accurate, comprehensive provider information as a key decision factor. Well, AI can help you produce patient-friendly profiles, FAQs on your websites, and summaries while helping you maintain accuracy across the interwebs. All right, so personalization. Patients expect proactive, tailored communication throughout their care journey. We all realize that there's lots of automation and AI going on in the world, but I want it to feel like you're talking to me directly. That's where AI can help us. It can help us by creating smart workflows and engagement tools that'll help us scale. It's empathy-driven, context-aware messaging. That's a mouthful. So when it comes to digital convenience, we're talking about tools like chatbots and virtual assistants to help us enable seamless scheduling and optimize those workflows. We're talking about robust AI-powered provider directories and review management tools to enhance credibility and engagement with our patients. And we're talking about personalized reminders, follow-ups, health tips, all based on the patient's individual needs. So let's solve for digital convenience. And I promise I'm going to get to some case studies here. We're just setting the framework for this discussion. So solving for digital convenience, because we know patients said, this better be super convenient or I'm popping over to the next website that is. So if 61% of patients prefer digital first solutions like online scheduling, AI-powered scheduling systems can reduce the staff workload while providing 24/7 access to your practice. Now, the operational challenges is that we have high administrative workload and inefficiency in appointment management. We already know this. So what's the opportunity? Well, patients expect proactive, tailored communication throughout their care journey. AI can help us with that. And it can give us that empathy-driven content that sometimes we don't have because we're just trying to get through the day-to-day. So let's start with digital scheduling. Well, data shows that almost 50% of appointments are now booked online. If you are not booking appointments online, you are missing this boat. You are adding friction to the patient experience, and this is the number one thing you should start thinking about, because we know that almost half of all appointments are now booked online. Well, the adoption of online scheduling has led to, this is according to the numbers, a 90% reduction in no-show rates, thanks to timely appointment reminders. So it's not good enough that you just have online scheduling. Now you have to have these automated appointment reminders as well. AI can help us with all of this, including automation using AI. And then let's look at these digital natives, because these are our patients at this moment. In 2024, that's last year, 60% of millennials preferred to book appointments online, indicating a growing trend among younger generations. Point being that we have to be able to remove all the friction from the patient experience when they're coming to our website. We've got to have online scheduling. We need to have appointment reminders, and we need to do it yesterday, because these younger groups, the millennials that we used to talk about a handful of years ago, Their kids are in high school now. Their kids are getting ready to go off into college. These millennials are in their mid 40s for some of them at this point, and they are the patient that we're going after. So let's look at AI-powered solutions for this digital convenience. We talked a little bit about why digital convenience matters. Well, it matters because we're all really busy. There's a lot of Netflix shows out there to watch. There's a lot of soccer games to go to. There's a lot of life to be lived. And AI should help us. AI should provide us an opportunity to have an easier workflow, whether it's a life workflow or a work workflow. So what are the pain points for dealing with this whole digital convenience side of things? Well, one is if you're going to adopt digital scheduling, you got to integrate it with your existing system. And maybe your EHR doesn't allow for it. Maybe you have a preference sheet per provider for your 20 doctor practice, and everybody has a different preference, and you can't even imagine having to put that into a digital form to allow patients to self-schedule. Maybe, patient adoption and accessibility is tough. Maybe you have an older population. You're just not sure if they're going to buy into digital self-scheduling. Maybe your practice is special and you've got to customize whatever the tool is off the shelf, customize it for your practice needs. It's tough to dive into self-scheduling or, this digital convenience that this younger generation, and really, frankly, all generations are expecting at this point. Maybe you need to leave availability for overbooking, kind of like the airlines do. Maybe it's tough to maintain those accurate profiles. Maybe you're concerned about privacy and security. Maybe, you're thinking, sure, I'll go ahead and have online booking, but I got all these no-shows and, I don't want to throw off my scheduling and then all of a sudden I'm underbooked. Maybe you're worried about the cost. These are all pain points, and they are 100% real pain points that everybody's feeling, but we need to think about them. And ultimately, when it comes to a decision of whether or not you're going to solve for the digital convenience, is the juice worth the squeeze? Well, I'm here to tell you that the juice is worth the squeeze. So here's a quick use case. I have a practice that I work with that implemented online scheduling about 18 months ago. And about 24 months ago. And they made it available via the practice websites. Patients now self-schedule. They are a 47 provider practice. And I think you can self-schedule with the doctors themselves. So 25 doctors, let's say. You can self-schedule. Everyone has a different preference. The juice worth the squeeze? Absolutely. They saw 41,349 appointment requests, appointments scheduled directly through the website in 2023, I believe, which was that was 2024, and which was an increase of almost 20% year over year. And subsequently, since I put this chart together, we actually went back and took a look at their self-scheduling and where we could make it, where we could reduce even more friction and make it much more efficient for the patient on the other end. And in doing that, this is an independent practice. And in doing that, we went and actually looked at some of the hospitals and how they were bringing forward self-scheduling to see, what could we mimic on theirs? How could we be better? Because, they have lots of money, whereas the independent doctors don't always have lots of money. And so we're kind of looking at the hospitals in terms of what technology that they're using. But the fact is the independent physician groups are light years ahead of some of what the hospitals are doing, because the hospitals, it's so nuanced that what we found is that hospitals aren't offering the same level of self-scheduling and aren't solving for digital convenience as much as these independent practices that we're working with. So is the juice worth the squeeze? I would say absolutely the juice is worth the squeeze. It's going to be tough getting there. But once you've got online appointment booking available, your appointment engine is booking 24/7, kind of what that article I just read is, AI allowing us to kind of run on a 24/7 cycle, because you're not having someone pick up the phone. Your patients are actually able to do this themselves. So first case study of the day. The next is chatbots. Chatbots are a great way, and they're moving at light speed. And I think if anything from a tech standpoint was moving forward and improving day to day, I think chatbots are really one of those things that are improving a lot faster than anything else out there. So if you want to solve for digital convenience, the expectation of the new patients, chatbots are a way to potentially solve and get that 24/7 kind of availability for patients going. AI and bot technology can automate over 70% of tasks in the healthcare industry. This is data from STAT. And chatbots offer 24/7 availability. They can provide immediate responses and support around the clock, eliminating the need for patients to wait for office hours. I think this is the biggest game changer we've got out there. So this is kind of how a chatbot works. One, patient asks a question, what are your hours? Types it in. We've all been there. Like, I have a customer service issue. What hours do you open? Chatbot provides a quick response. And then, if you've got online scheduling, the patient books their online appointment, no front desk, nobody's required. It's all seamless and it's all behind the scenes and it's all done from the comfort of their couch with their cup of coffee in their hand. So why haven't you implemented a chatbot on your website? Well, let's look at the challenges. One, historically, they're not all that personalized. They can be kind of wonky in the way that they work. They've got this limited scope of responses. And that's because historically, you come up with the questions, the FAQs, and then you feed it to the chatbot and the chatbot answers the questions. As long as you've given it it'll provide an answer as long as you've given it the question. But if a person out there thinks of something that you didn't think of, chatbot can't answer it. That's always been the issue. How do you integrate it with your systems? This has always been something to think about. How can we protect PHI? Sometimes patients are going to give up their information. It's not on the patient to think, geez, I'm giving my social security number here, on this little chatbot. It's really up to you to say, I'm not willing to take the social security number. Some patients may be resistant to using the chatbot. The chatbot may give them the wrong answers to things. Having these chatbots and online scheduling and everything else, we also might become too reliant upon automation. How do you handle multilingual patients? If you're in a trade area, I'm in Central Florida, we have a very large Spanish-speaking population. We have a very large French-speaking population, specifically Haitian population. How do I get my chatbots to work with those populations and make it feel like a personalized experience? And how do we address the more complex scenarios? Historically, as in 6 months ago, this is the kind of thing we were talking about. So with that said, is the juice worth the squeeze as it relates to chatbots? And I'm going to say abso-freaking-lutely. Because here's an example of a specialty pharmacy that I work with that uses chatbots not to interact with patients, but to interact with referring physicians. And since they launched this thing in June of 2024, this data is, you can see here, through the end of December of 24. Since they launched it, they had 659 active conversations via HIPAA-compliant chatbot. Can I just say, we're talking a lot right now about patient experience. So what the patient expects, well, the doctors that we're working with, the ones that we're relying on for those referrals, they also have a level of expectation that's different than it ever was before. And so we can be looking at these tools from a consumer standpoint, but also remember there's different types of consumers. There's different types of audiences. This is a great case study that says, what they do is they put a pharmacist on to manage the chatbot and to work with it on a regular basis, and they're directly answering those questions from doctors. So when we're talking about AI-powered solutions for digital convenience, we've got, digital scheduling, which increases our patient satisfaction. And then we have chatbots, which reduce the administrative burden. These are easy ways that we can meet patients where they are and really focus on this digital convenience. So let's talk now about building transparency and trust. And I've got more case studies for you too. There's been a shift to interactive engagement. We know this. We know that people want to schedule online. We know that people like telemedicine. We know that, 5-star reviews matter. The communication paradigm has shifted towards interactive two-way dialogues, allowing for greater patient engagement and satisfaction. Two-way dialogues, even if there's only one person in the conversation. We also know that access to information has empowered patients to be active participants in their healthcare decisions. And we know that, online reviews is kind of like the new public relations out there. When a patient has a negative experience, that negative experience oftentimes gets made public. So we know that the quality and completeness of provider profiles is the number one factor to booking appointments. We know that 65% of patients disregard reviews older than a year old, meaning you got to have a lot of new reviews. And we know that there's an operational challenge of maintaining accurate and up-to-date provider profiles at scale, meaning you've got to make sure that your information is correct on all the directories, all the Google pages, all the Bing pages, all the Apple Maps, all the Google Maps, all the health grades, all the RateMDs, you name it. So let's talk about how AI and automation can help us in building transparency and trust. So here I've got on the screen two kind of scenarios. One is a 2-office, 16 provider practice, means that they have 18 locations. It's 932 listings. They got 55 of them that need some kind of help. So if your practice is about this size, that is kind of what you're looking at. And then at the bottom, we have a practice with 10 offices and 38 providers. So online, their online profile is now 48 locations, which is 2,423 individual listings online. That is that accuracy of information stat that I keep giving you. And no one person can really manage this. I mean, 2,400 listings is a full-time job for somebody. So where does the opportunity with AI and automation live? Well, AI can produce these patient-friendly profiles, FAQs, and summaries while helping to maintain all the accuracy that you need to dedicate towards making sure that these profiles are current. And natural language processing can help us analyze the feedback that patients are giving us so that we can improve our operations in the practice itself. So here's that 10 office, 38 provider example that I gave you. Without AI, no single person can maintain this. This is just like a glimpse of the 2,423 listings and resources out there that you have to maintain on a regular basis. But with AI, and hopefully this is going to play. So this is just my computer here looking at reviews, making all kinds of noise, summarizing, using AI to summarize the reviews that a practice has received. And so what that does is we use AI to scrape the internet to tell us what people are saying about our practice. And then we use natural language-based processing to analyze the feedback. So if you look at the stuff here on the left, this is the positive feedback. This is taking AI and having it scrape the web and tell us what people are saying about us. And on the right are the areas that we could do a little bit better. These are your negative 1, 2, 3-star reviews. And so from a marketing perspective, the items on the left, we want to use in our marketing. We want to talk about those positive outcomes, that welcoming environment, that above and beyond service. These are buzzwords that we can now use to attract patients. And on the right, these are the negatives that we can now take, summarize, circulate from an operational standpoint, use this as a training and a learning opportunity for our staff. So there's a lot when it comes to online reviews. So let's look at the challenges. Well, first, maintaining those accurate provider profiles. I mean, that's a big lift, especially if you're a larger practice. And keeping them consistent across platforms, super important. We need to address all the patient reviews. Can we use AI and automation to do that? Sometimes it can be daunting. That's why we're paying thousands upon thousands of dollars a month for third-party providers to help us with this. We need to ensure that patient data remains private. We've got to have that huge online presence that everyone tells us we have to have. And we have to show accountability for making mistakes. That's the thing. The public relations of today is all about, 1, 2, 3-star reviews. And when somebody has a negative experience, they put it online, and it's your job to now get it offline. So is the juice worth the squeeze? Well, I'm going to show you where I think the juice is worth the squeeze. So using AI and automation, and this is using a third-party provider to help us, but they have pretty entrenched AI and automation into their process now. So I take that 10 office, 28 provider practice that I've referenced, and we look at what happens in the last 12 months. And if you recall, when I was talking at the very beginning here about the importance of the new patient experience and patient preferences, maintaining reviews, maintaining these online directory listings, right up there with number one decision in terms of whether I choose to come to your practice or the practice down the street. So if you look at the last 12 months on Google, this practice has a 4.9 star rating. They have sent 76,000 roughly patient review requests. So when somebody comes in for an appointment, they send an automated text message that goes to the patient gets asked to leave a review or not. So in doing that, in automating that process, they have been able to get just over 9,000 new reviews in the last 12 months, of which 7,567 are 5 stars, which is great. So what this is doing is it's answering kind of the bigger question of the online directory listings and making sure that they're current. And then it's also helping the patient in their in choosing their provider, because it's providing Google and Healthgrades and you name it, that constant influx of new reviews, which we know is super critical to the patient journey in general. So in addition, just to the number of reviews that this practice received and how it's helping them from that standpoint, these reviews have also generated them 875,000 profile impressions for their doctors, 33,000 visits to their website, 53,000 clicks on how to get directions to their practice, and 38,000 phone calls. And we do this, and we kind of juice this engine up by using AI and automation to simplify this process. And the result is this. And so if you go back and you look, 10 offices, 28 providers, we've automated the online review process. The more reviews we get, the happier Google is. And this is what Google gives us back as a gift, but a tremendous amount of traffic and direct ROI that we can say our efforts on this online reviews and directory listing management and making sure we have 4 and 5 stars is paying off for the practice in general. So is the juice worth the squeeze? Absolutely it is. So we need to build that transparency and trust. So let's look at let's revisit the discovery, consideration, and selection process for the patient journey. Well, we already talked about it. Patients are relying on digital sources more than 3 times than they are going to their PCP anymore. So, and 2 times more than provider and personal referrals combined. This is the very first time that patients are now going to Google before they're going to their provider. Very first time since Press Ganey has been doing this report. On average, patients are reading about 5 reviews and visiting 2 to 3 websites before they're choosing their provider. And the quality and completeness of a provider's online profile is the number one factor before someone books an appointment. So you can automate this process. And if you can automate this process, then not only are you making the patient journey better and kind of meeting patients where they are, but you're helping to reduce that staff burden at the practice as well. So let's now talk about creating personalized user experiences, and then we'll do this, and then we'll wrap it up. So 64% of patients are loyal to practices based on quality of service. This includes communication and follow-ups. Quality of service isn't just what happens inside your 4 walls, it's everything around it. 56.5% of patients value consistent communication. We want to be reminded that we have an appointment coming up and we want to be followed up with. You can automate this using AI. But the operational challenge is, how do you scale personalized communication without overburdening the staff? Well, the opportunity is to use smart workflows to automate reminders, health tips, personalized follow-ups, and use generative AI to craft messages kind of at scale. So let's talk about ideas for smarter workflows. Well, we have appointment reminders and follow-ups. You have someone book an appointment, you automate the process where 3 days before the appointment, they get a text message that says, hey, you have an appointment coming up. You could automate your patient onboarding. Patients don't want to come in and fill out a piece of paper in your office that then they hand, and it's the same questions every time, and then they hand it back to someone at the desk who then has to type it in or scan it in, or who knows what they do with it. They want to do this online. We want to be able to automate the process for collecting feedback from patients, which we kind of just talked about. We want to look at drip campaigns for patient engagement, potentially referral management, and patient re-engagement. So let's look at a use case number one. So this is a small orthopedic practice who has automated pre and post-surgical text messages. Now, it was an orthopedic surgeon, who built this app and then ran this app through, did some testing, and then published the results in JAMA a couple years ago. And his results said that patients spend 8.6 more minutes per day on home-based therapy exercises, leading to better outcomes. This is when patient has an appointment, then has scheduled surgery, and then what they're getting are these like post-surgical text messages to come with. They made 2 fewer calls to their surgeon's office on average, which helped reduce the administrative workload and enhance efficiency. Almost 95% of patients strongly agreed that they were provided with clear recovery instructions. Before the text messages, that was only about 47.5%. And the intervention group patients discontinued narcotics 10 days earlier than the control group, demonstrating improved pain management and reduced dependency. I think that really matters. So we have a practice that we work with that uses this. It's a small group. They have 3 surgeons, I believe, and they put every post-surgery through this text process. And we hear about it all the time from the client saying, they get patients who'll be like, the doctor sent me a text message. And what it is we've gone in and pre-recorded videos with the doctor saying, okay, you have your surgeries tomorrow. I need you to discontinue food. And the doctor's speaking to the camera, and then it gets delivered via text message. Or they're like, okay, you're starting to feel some stiffness in your knee. This is normal. Make sure you're doing this. Make sure you're doing that. Just personalizing that experience. And they've set it up one time and they've just forgotten it, over time. Now, when a patient gets scheduled for surgery, they get their phone number put into the system. It automates that process, and these are the types of results that they're seeing. So use case number 2, you can automate patient referrals. Now, I kind of mentioned earlier about the chatbot, using the chatbot to build those referral relationships, but you can also create online forms that are HIPAA compliant online forms that you can then use as part of your referral management when you're out there pounding the pavement and say, hey, doc, if you want to send us a referral, you can go to the spot on my website, here, go to this page or whatever, and fill out this information. And then we have a record of the referral. We'll keep you in the loop on communication. This is kind of a workaround for interoperability issues, but it's a great way to test the waters if your referring providers will send you referrals digitally versus the old fax way, or, a referral pad or something to that effect. And we've really started to see good results from making this an automated process. And you can do this through automation and through some AI as well. And then you've got patient onboarding. 80% of patients prefer, using digital forms versus the printed forms. And AI-driven forms can help you with 95% accuracy because you don't have somebody filling out a form in the office and then you're having to type it in. And so the old way are these medical history forms. The new way, put them online, HIPAA compliant, somebody fills it out, it automatically goes into their patient chart, and you're ready to rock and roll as soon as they show up for that appointment. Here's another use case. It's automating the patient acquisition. So just an example of an OBGYN practice that I've been working with for years. They wanted to bring in new patients, and they wanted to educate the patients on the front end. So when they came in, they already kind of knew what they were expecting. So we built a quiz for their website. We do a lot of these quizzes, and they're super simple. Take them back to your marketing people and say, I want to do a quiz on the website for lead generation. So this quiz was, could it be menopause? It takes about 60 seconds to fill it out. We ran this for a little while, and they got 256 entries into it. Once they fill out the quiz, it takes them to a thank you page. And then once they go to the thank you page, it gives them a couple things about managing menopause, and it triggers an email automation. Email automation has already been written. The first one is a thank you email. The second one says, hey, here's a little bit more about our practice and what you can do, before you come for an appointment, or what you should know about menopause. And the third says, hey, maybe you should schedule an appointment. And it's all set up, we build it one time, and every patient that enters this, or every, potential patient that enters this, gets the same thing. And so communication is tailored to them based on their needs, and it's educating them about the practice, and it's pushing for that follow-up appointment. So with that, we got 256 quiz entries. This ran for about 6 months, not even. 700 emails were sent, open rate of 64%. It's pretty good when you consider you do it once and then you kind of forget about it. So how can we digitize as much of the patient journey as possible? One, we can do scheduling. Two, forms. We talked about that, specifically intake forms. Yeah, you could offer telemedicine. You could automate the no-show retrieval and follow-ups, and you can email patients to keep it top of mind for them. But you got to make it easy to do this. So is the juice worth the squeeze? Well, the challenges are similar. We've got integration issues. Is it compliant? Is our patient data protected? Some of our patient journeys are more complex than others. It's hard to be personal and scale. We can get too reliant on automation. There's maintenance on the workflow stuff, because sometimes you have to change the workflows within the email communications. And, patient engagement, are the numbers strong enough? And then you've got, this high satisfaction and trust through onboarding engagement. The other challenge is, how do you reduce the administrative burden with automation? We can reduce no-shows and have better treatment adherence with automated reminders. We can, maybe have more effective referrals, and we can reduce patient leakage through these automations. And we can have stronger patient-provider relationships by using these feedback tools, meaning patients leave feedback, we take it back to the provider. We improve operations, which means we ultimately improve the practice. So let's just try to refocus it all back in. So we have the rise of AI and automation in healthcare marketing. We know that 60% of healthcare providers are going to use automation to help with staff shortages. They're going to try to reduce the administrative load on everybody. We can use AI and automation to help us with that. AI chatbots can automate over 70% of our administrative tasks, improving efficiency and enabling 24/7 access for patients. And chatbots, I barely touched the surface, but the fact is they can answer in other languages. They are now AI driven, so that it's not the same as it was 6 months ago. It is super robust, and almost the barrier to entry is so low, there's no reason not to be doing AI powered chatbots. We also know that patients have shifted to this digital first engagement. Now, over 60% of consumers want to book appointments online. If you're not doing that for them, then you're really kind of, behind the eight ball on this whole digital first patient experience. Patients now rely on digital sources 3.1 times more than provider referrals. You're focused on knocking on doors to get those referrals, but the fact is patients are self-referring for specialty care at this point. And, personalization and trust in healthcare is paramount. 64% of patients remain loyal to practices who have high customer service indexes. And 52% of patients say access to accurate information online is the key driver, and who they're choosing for their healthcare.
If you want more like this, hit like and subscribe so you'll always be alerted to new episodes when they come out.
And if you want information about us, visit us over at insightmg.com. That's insightmg.com. We'll see you on the next episode.